Hello friends. In our previous lab we have completed all the inflammatory lesions which are seen in the breast. So now let us describe about fibrocystic changes in the breast. So fibrocystic changes is the most common benign condition of the breast. So it may produce a lump over the breast. Right? So what is its incidence? Its incidence is in 20 to 20% of adult women is its incidence. And when is it common? It is common in 3rd to 5th decade of life. Right? And here during this 3rd to 5th decade of life, if you just remember, there is decrease in role of estrogen. Right? If you see, there is from 3rd to 5th decade of life, there is presence of estrogen in our body, and after 5th decade of life, there is decreased incidence of this cancer. Of this fibrocystic changes. So this proves that there is role of estrogen in its pathogenesis. Right? This is previously called as a disease, but currently, right now, it has been discovered to be a physiological change rather than a disease. Logical change now. Right? As this fibrocystic changes in breast has different features which are cystic dilatation of ducts. There is inter and intralobular fibrous tissue, and there is even epithelial proliferation. I would draw each and every diagram for each and every lesion which we discuss in fibrocystic changes. So it is really important for us to identify these fibrocystic changes. So how do we identify these fibrocystic changes? The patient basically she presents you with a lump over her breast, and once FNAC was done, then you can see the cytology of the area, and then through that you can know the fibrocystic changes. So these fibrocystic changes, as I have described previously, they are of two types. One is non-proliferative fibrocystic change. Right? This is also called as simple fibrocystic change. So this is the main type. So this non-proliferative fibrocystic change or simple fibrocystic change basically has two features. One is it has many cysts which are of varying sizes, various different sizes, and there is increased fibrous stroma. Right? So the cysts are basically, what are cysts? As I have already said, these cysts are nothing but the dilatation of the collecting ducts. So why are these cysts are formed? What might be the reason? So what might be the pathogenesis? This is just an imaginary pathogenesis, or there is no proof for this pathogenesis. So basically, there is estrogen may stimulate fibrous overgrowth following inflammation. Whenever there is some form of inflammation due to something, it may stimulate this fibrous overgrowth. This may lead to fibrosis, that is on either sides or around the ducts there may be fibrotic lesions. So this fibrosis leads to obstruction of the duct becomes obstructed, and these obstructed ducts are dilated. Obstruction of collecting ducts. So due to the obstruction of these collecting ducts, so there is obstruction, think that there is obstruction here. There is secretion of milk. So this milk becomes dilated and dilated. Because in order to accommodate a large amount of milk, it becomes dilated. So dilatation of these collecting ducts are seen, which are basically now called as cysts. Right? This might be a possible pathogenesis which was explained. So what are the morphological features or lesions of the disease? So the lesions of the disease include, first, let us take it grossly. So grossly, you can see cysts which are bilateral mostly and multifocal. They vary from some microns to centimeters in that is 5 to 6 centimeters in diameter, and they are usually round, translucent, with bluish color. So this bluish color and round character, we can call them as blue domed cyst. Right? Right. So whenever you open this cyst will have a thin serous to hemorrhagic fluid. Right? So these are the lesions grossly you can see. And what do you see microscopically? So microscopically, as I have said, there are two main features here. One is cyst formation. So I'll just draw here. So think that this is a cyst, right? Which is nothing but a dilated duct. So this is a cyst, and this is filled with serous to hemorrhagic fluid, and there is increased, this is a duct, right? Basically cyst is nothing but a dilated duct. Around the duct there is fibrous stroma or fibrosis is seen, right? This is fibrosis which is seen, and sometimes there is in the glands or in the apocrines sometimes or frequently, very frequently or sometimes there is apocrine metaplasia which is seen. So these are the normal cells, and there is apocrine metaplasia, that is, apocrine cells which are pinching cells, they lose their part by pinching. So apocrine metaplasia is seen like this, right? And sometimes epithelial metaplasia may also be seen. So this is an epithelium, and this undergoes metaplasia, right? Epithelial hyperplasia. Hyperplasia is increase in number of cells. Epithelial hyperplasia may also be seen, and very rarely adenosis can be seen. Adenosis is nothing but increase in glandular things, that is increase in lobes. So these are adenosis. So all this stroma becomes fibrosed. So this is the basic structure of the thing. So this is adenosed glands will have these, and this cyst is lined by flattened epithelium, right? And this is an apocrine gland. So right. So just let us now see what are the features of this microscopic features. So one, I don't have place to label, I must have drawn it here, fine. One of this feature is cyst formation. right? And this is lined by flattened epithelium, right? This is 2. And the third one is apocrine metaplasia. The fourth one is epithelial hyperplasia. Right? And the main fifth one is fibrosis of stroma, increased fibrous stroma. And these are adenosis, right? All these are the microscopic structure which is seen in non-proliferative fibrocystic change or simple fibrocystic change, right? So now in the today's class we have learned about one of the fibrocystic change, which is non-proliferative fibrocystic change, pathogenesis, lesions and its microscopic features. In the next class we would learn about proliferative changes of the breast. Okay, bye.